Chris Kresser said there's about 8 major studies that compared lifespan in vegetarians and vegans and omnivores. He claims these studies had flaws and don't show proof that vegetarians and vegans have longer lifespans than omnivores. He also said 2 meta-analyses were done that found no difference between vegetarians and omnivores in total lifespan. What do you think about all this?
The question, do vegans live longer, is really impossible to answer. In part, the movement isn't all that old. I mean, there were not many people eating an all-plant diet 25, 30 years ago. And even in 2020, there aren't that many people eating an all-plant diet. They're not being tracked in a database routinely. And it's going to take decades to really make an assessment. So it's a flawed question. Therefore, the data that's out there itself is somewhat flawed. We do have little pieces of data, or at least some published research. The Adventist Health Study, many people have heard of that out of Loma Linda. That all started with the observation that the average lifespan in Loma Linda in the 1950s was perhaps a decade longer than the average lifespan in the rest of California. And an average decade of life is a huge advantage. And that prompted the question, why? And it became apparent that about half of the people in Loma Linda followed the Adventist guideline of eating a largely or exclusively plant diet, and half ate a typical California omnivore diet, but that was a much higher percentage than the rest of California. There are other differences in their alcohol and smoking and fitness and such, but nutrition was felt to be the biggest difference. And in the Loma Linda published research studies, it appears that there may be a better lifespan amongst those that follow the plant diets of the Adventist Church. I find it a tiresome argument because truly we don't have the scientific capacity to really know it for sure. On a biochemical level, the pathways that cause aging and the diseases related to aging like cancer, diabetes, Alzheimer's, and heart disease are activated much more by animal foods and plant foods, talking the big 3 ones called sirtuins. It's a pathway of aging. And what is the group that activates it for health? They're grapes and peanuts, polyphenols like resveratrol. There's a pathway called AMP kinase, believed to be very important in aging and disease. And the natural substances that activate it are citrus fruits and not meats. And then there's finally the pathway called mTOR, which may be involved in aging and disease process and cancer and Alzheimer's. And you activate it by meat foods, not by animal foods. Not by plant foods. So from a scientific level, people that eat good quality, whole plant diets should be at the option of living longer than people that are eating meat-heavy diets. But a super clean, meat-heavy diet with some greens versus a super clean, whole food plant diet has never been compared head-to-head. We're not going to have mortality data. It's sort of a topic we should move on beyond. And if you feel good and you're not on medication and you're productive, stick with your diet. And if you care about the environment, stick with a plant diet. There are a group of researchers, it's very interesting, like Dr. Ansel Keys, who followed the Mediterranean diet for about 60 years of his life. He lived over age 100. There's this famous researcher, Jeremiah Stamler. He was part of that group. He just celebrated his 100th birthday. There's a famous researcher from that group called Henry Blackburn in Minneapolis. He's approaching his 95th birthday playing his clarinet. I mean, it's an interesting observation that some of these scientists that studied the Mediterranean diet beginning in 1950s and adopted it have had exceptional longevity. But you can't base your decision solely on that, because somebody that ate bacon and smoked cigarettes is going to live over 100 too. So you got to just take the whole large panorama of data, including environmental data and animal rights issues, and it all favors plant diets.
In the year 2000, the World Health Organization, after looking at 800 papers with 22 world experts, reported an 18% increase in cancer risk from eating processed red meat. Tell us more about this.
Yeah, at least I was stunned. Maybe the world was stunned. It was actually October 2015 when there were articles published in the British journal called The Lancet by the World Health Organization and one of its cancer agencies International Agency for Cancer Research. And they published that they had been going through all the world's literature. They had 800 research papers. They had 20 or 22 scientists that seemed to be without conflict. Now, that's almost 5 years ago, and there has not been any real allegations that the scientists that went through this research had financial or other biased conflicts, which is always refreshing. And they concluded that it's not only that the intake of processed red meat, the bacon, salami, hot dog, pepperonis, were associated with a high risk of cancer of the rectum and the colon, but that they actually caused it. They thought there was enough science, basic science, human science, petri dish science to say, when you eat a hot dog, you're increasing your risk of getting cancer directly. It's a clear data. Then you have to look at how big is the risk and how does that compare to other lifestyle habits. And they came up with this overall statistic that relative risk was 18% higher. I think the best way to understand that is other data looking at the risk of living in a home with secondhand smoke or working in a situation where there's secondhand smoke raises your risk of lung cancer by a relative value of 18%. So smoking 2 packs a day is more risk to your health than eating bacon and hot dogs, but it's on par with the secondhand smoke issue. Since October 2015, these studies have not been retracted. They've not been found to be flawed. The research group has published at least one follow-up paper I'm aware of in 2016 that confirmed and extended these observations. So the public response should be reduce or eliminate, for sure, processed red meat. You know, they also found that red meat in general was associated with cancer of a variety of kinds, breast cancer, pancreatic, ovary, and colorectal, but they did not come down with the stronger statement that red meat, the unprocessed red meat, like perhaps a steak, was a direct cause of colorectal cancer. So we really should be focusing for public health and public education. And it's not a vegan issue. It's a medical health issue of teaching the avoidance of these foods, bacon, pepperoni, hot dog, salami, corned beef. As I've said, and I will continue to say, the obligation is for hospitals to take the lead. Hospitals should ban hot dog, pepperoni, salami, and bologna from their menus because it causes cancer. And they should not be serving foods that have been determined by a high-level scientific community panel that cause cancer to their patients, to their employees, to the guests. They should educate the public and the employees and the patients that we don't serve bacon and we don't serve hot dogs and we don't serve pepperoni pizzas and such because we care about you and they cause cancer and we're not pro-cancer. But I don't know of a hospital in the United States who's had the cojones to take a stand and ban these foods. So it's time, and everybody should speak up about it and write to hospital executives because they're the ones, it's all a money issue. They're the ones that have got to change policy.